This presentation is for Gerontology. We're presenting on rest, sleep, and activity. I'm Jessica Jacobs.
I'm Daniel Lewis.
I'm Erin Javier.
And I'm Cassandra Romerine.
Okay, for an introduction to rest, sleep, and activity, as humans we spend about a third of our life sleeping. We're dependent on our need for rest, sleep, and activity to function appropriately. Lack of adequate sleep and rest can affect all activities of our daily living. Activity as well is necessary to maintain physical and psychological integrity, musculoskeletal strength, agility, structure, and cardiopulmonary endurance and function. Rest, sleep, and activity are vital to overall physical and mental well-being. Healthy older adults with positive moods engage more in active lifestyle, and meaningful activities bring better sleep and fewer complaints regarding sleep. Poor sleep is not a consequence of getting older, but an indicator of health status that needs to be investigated. Our plan is to increase public knowledge of the benefits of adequate sleep, rest, and activity. We will teach on health trends and teach on nursing interventions that promote proper sleep and rest. Throughout the presentation, we hope to educate you on age-related changes that can affect rest, sleep, and activity, discuss the importance of rest, sleep, and activity to the health and well-being of older adults. We will also describe the benefits of exercise and appropriate exercise regimens for older adults. Thank you.
So, why are adequate sleep and activity important? Sleep is one of the most basic needs of the body. It helps the body to fight off infections, provides metabolism support, staving off things like diabetes. You need sleep in order to have energy to carry out all of the daily activities. Helps to reduce medical errors. If you're tired and you take a lot of medications, you're more likely to double dose or miss a medication that might be potentially life-saving. Maintaining an active lifestyle. You have to have sleep in order to maintain your activities. And it helps to improve social relationships. Being sleepy makes you tired and grumpy, and it's hard to have a good relationship when you're always in a bad mood. Activity helps to enhance the health status, helps to maintain your functional abilities, and it helps to stave off chronic illnesses and diseases. Staying active helps to improve balance, pain reduction, and psychological well-being. The effects of inadequate sleep and activity. Not enough sleep can lead to things like heart disease, high blood pressure, obesity, diabetes, poor quality of life, and limit your functional abilities, as well as lead to a loss of independence. Poor activity can lead to early death, coronary heart disease, stroke, high blood pressure, type 2 diabetes, breast and colon cancer, falls, and depression. So some health trends. In 2012, 69% of adults reported insufficient sleep. That number jumps to 76% for adults over the age of 65. And then between 2011 and 2012, the number of sleep-related motor vehicle accidents increased by almost 23%. And 80% of adults do not meet activity guidelines. Between 1997 and 2012, there was a 25% decrease in desire to participate in physical activities.
Nursing interventions are what we do as nurses to help our patients reach their goals. In order for our patients to reach their goals of a healthy sleep-wake cycle and a healthy activity cycle, we need to make sure that our patients are getting adequate rest and sleep. The best way to do this is through creating an environment that nurtures their rest and their sleep. Older adults are known to be in and out of stage 1 of sleep more easily than their younger counterparts. They also have a delayed sleep start. Then this causes them to not be able to fall asleep as easily. And they have what's called a phase advance, where they sleep earlier in the day and they wake up earlier in the morning. Now this makes them more tired throughout the day, less able to keep up with their younger, siblings or grandchildren. And the best way to do this is to establish a sleep-wake cycle. Maybe have them fall asleep a little later at night, and then maybe they'll be able to sleep a little bit longer in the morning. Pain assessment is very important. Your patients will not be able to sleep very well if they're in pain. Oftentimes you think, oh, they're sleeping, they're not in pain. They're just exhausted from pain. So adjust their pain medication adequately. Look for signs and symptoms. Sometimes your patients aren't going to tell you they're in pain. Look for guarding, wincing, restless sleep. Also avoid stimulants. Caffeine before bed is obvious, but other medications may also cause them to be restless during sleep. Establish a routine, make sure they're falling asleep and waking up at the same time and creating that environment to nurture the sleep. Sleep studies are important. Your patient might have sleep apnea or restless leg syndrome, and if you are able to diagnose that issue, you can address it and better their sleep. Regular activity promotes healthy sleep. If they're active throughout the day, they'll be able to achieve a deeper sleep at night. Also, with promoting activity can also promote sleep. So make sure that you're getting good activity throughout the day. They suggest that you do about 30 minutes 5 times a week. For your elderly patients, you don't want them to do rigorous activity if they can't handle it. Adjust it to their individual needs. Maybe doing light walking for 30 minutes is totally fine as long as they're getting their activity in. Personalize those programs. Also, there's community programs they can get involved in. There's different activities for the older adults throughout the community, community groups that they can join and become a part of and get that activity in. Establish goals. If they have something to work for, they'll be more likely to achieve it. And then evaluate and reestablish those goals as their either disease progresses or they're getting healthier and they're able to tolerate more. And the benefits are obvious. They'll get better activity throughout the day, they'll be stronger, and they'll get better sleep at night.
Some of the alternative options for promoting good sleep and adequate rest, you want to avoid drinking alcohol at least 2 hours before bedtime. You can also practice relaxation techniques, use aromatherapy, playing soft music, or even do some massage. You want to avoid taking naps. You want to make sure that you maintain your area, quiet, less lighting, and as much as possible, refrain from taking diuretics. You don't want to be urinating every 5 minutes, having to wake up like that, And you want to make sure to also manage the pain, like she said previously. You want to make sure that they're not hurting and having to wake up and move around so much. You can also use pharmacological medications for treatment to promote sleep. You want to use benzodiazepine receptor agonist like Ambien. This one has a short half-life and much safer for older people. However, this should only be used short-term. You can also use a melatonin receptor agonist, which is a Ramultan, that promotes sleep via action on the circadian sleep. You want to refrain from taking sedative and hypnotics. Also, a lot of people think that over-the-counter drugs like Benadryl and Tylenol PM are good for older people, but actually this should be avoided because of their side effects. For alternative option for physical activity, studies have shown that increased physical activity improves health outcomes for older people. So things that you could do as simple as walking to the store, cleaning the house, gardening, washing plates. You can also use Wii game, which is a gaming system where you could pretend like you're playing volleyball, bowling, and also simple stretching and chair yoga. For those that can't really move around, you could use resistant bands as well.
Next up, we'll have Andrea to present her part.
We're good.
Hey, I'm Andrea, and I want to talk to you today about promoting sleep and rest for the elderly, and also about promoting activity for the elderly. So some things may seem normal to us, but we need to stress to the elderly adult group that in order to promote sleep and rest, we want to establish a normal wake up and bedtime routine. We want to avoid taking long naps during the day. We want to exercise daily. We want to avoid heavy meals close to bedtime. We want to avoid caffeine and alcohol. We want to avoid fluids 2 to 3 hours before bedtime. Take analgesics if needed. Sleep meds can be used, but preferably as a last resort. We want to pull curtains closed, make sure that all the lights are dim, turn out lights, use night lights in bathrooms and in bedrooms if needed, and close doors to keep the noise level down. So to promote activity in the elderly, we want to exercise. We want to exercise at least 30 minutes a day, 5 days a week. That can be like brisk walking, swimming, biking, cleaning, golfing, climbing stairs. And the CDC also recommends that you do stretching and balancing exercises weekly as well, and that can be done by yoga, lifting weights, push-ups, and sit-ups.